All right, if you're a nursing student or a brand new grad, you know this feeling. You get handed your first patient assignment and bam, your mind just starts spinning. It feels like a tidal wave of information, but trust me, it doesn't have to be that way. Today, we're going to break down exactly how you can tackle that first patient with real organized confidence.
Right? This is the big one. You've got a name, you've got a room number, and you've got this huge sense of responsibility. That anxiety you're feeling, it's totally normal. It just means you care about doing an amazing job. So let's figure this out. Where do you even begin?
The secret is having a system. Instead of just letting all those facts and numbers swirl around in your head, we're going to give them a place to go. We are going to build a powerful mental checklist that helps you process everything you need for safe and effective care right from the second your shift starts.
Okay, let's get into it. I want you to think of this as your patient intel briefing. It's broken down into 4 key missions. First, we'll build the patient's core file. Second, we're going to identify any critical safety alerts. Third, we'll map out the game plan for your shift. And finally, we'll understand the whole care team network. Let's kick it off with number 1.
This is ground zero. It is your foundation. Before you do literally anything else, you have to understand the basic story of your patient. Who are they and why are they in the hospital right now? This core file gives you the context for everything else you're about to do.
So what's actually in this core file? Well, it boils down to 3 absolute must-knows. First, their diagnosis. Why did they come through those doors? Second, their focused health history. Not every single thing, but the big stuff. Like if they have diabetes, that immediately flips a switch in your brain about blood sugar and diet, right? And third, allergies. This one is a big deal, folks. It's totally not negotiable, and it's how you prevent major errors before they can ever happen.
Okay, so you've got the patient's backstory. Your next mission is to zero in on immediate safety. These are the critical alerts you have to know to protect your patient and be ready for any sudden twists and turns. This might be one of the single most important things you check. Before you even walk into that room, you have to know, is this patient a full code or are they a DNR? You know, an emergency can pop up out of nowhere and you need to be ready to act in a split second, exactly according to their wishes.
And this chart is a perfect example of another key safety check, labs. But listen, it is not just about a single number. You have to look at the trend. Is their hemoglobin, like you see here, creeping down? Or is it getting better? That trend tells a much, much bigger story than one isolated number ever could.
Think of this as your personal cheat sheet for spotting trouble early. Knowing a patient's normal baseline is everything. What's their normal? Maybe their heart is always an AFib. If you know that, you won't freak out when you see it on the monitor. Are they usually super chatty and alert? Then if they're suddenly groggy, that's a huge red flag. This baseline is your anchor.
All right, you know who your patient is and you've got the safety alerts locked down. Mission number 3 is all about the game plan. What are you actually going to do today? This is the to-do list that's going to shape your entire shift.
This table here breaks it down so nicely. First, diet. Can they eat? Are they NPO? Meds. Are any of them super time sensitive? When was their last dose of pain medicine? What about IV fluids? And, just as important, their IV access. Knowing where their IV is and when it was put in is so crucial for planning your day. This is your action plan. And beyond those daily tasks, you got to be aware of all the hardware. Does your patient have something internal, like a pacemaker? What about external gear, like wound vacs or drains that need your attention? And always, always, always check for any procedures coming up. A surgery tomorrow might mean they have to stop eating today, and it's your job to know that and get that pre-op checklist done.
We are almost there. You've got the patient story, the safety checks, and your to-do list. The last piece of the puzzle is remembering that you are not in this alone. Patient care is a team sport, and you need to know who's playing.
So, who's on this team? Well, first, are there any specialists involved, like cardiology or nephrology? You got to know who to call if a specific problem comes up. Second, what's the big picture plan? Pro tip, a quick scan of the doctor's progress notes will tell you exactly what the overall goal is. And finally, who's their support system? Knowing that designated family contact is so important for good communication.
So, that's your 4-part mission for getting all that patient intel. But let's be real, gathering it is only half the fight. Now we get to the most practical question of all. How do you possibly keep all of this straight, especially when you have more than one patient? Let's talk toolkits. This is it. This is the million-dollar question for every single new nurse. You're juggling all these patients, and each one has their own story, their own needs, their own meds. How do you stop it all from just turning into a giant, jumbled mess in your head?
The great news is you don't have to invent this information. It's all there for you. You're going to get a ton of it during the handoff report from the nurse who's leaving. And for anything else you need to double-check or clarify, it's right there in the patient's chart.
And this right here, this is your secret weapon. A simple, organized report sheet. This piece of paper literally becomes your external brain for the shift. You write down everything from report, you fill in the blanks from the chart, you update it as you go, and it keeps you totally laser-focused. It's how you take that mountain of information and turn it into something you can actually use.
So as we finish up, I want you to really think about this. Using this system, what's the one thing you'll check first on your next shift to give yourself that solid foundation of confidence? Is it the code status? A key lab trend? Knowing that one thing can make all the difference, because that's the whole point, turning that anxiety into focused, competent, and confident care.